Okay, this will be the second 30-minute lecture on intro. This is kind of where we left off. So let's just run over some of these places on the body. Cephalon, that means head. You never hardly hear it used like that. Cephalic. Sometimes you hear it used. Cranium. Uh, You can also say cranial. That's the way you would use it in a sentence, like the brain is contained within the cranial vault or something like that. Facies or facial. Uh, let's go. Frons are frontal, like you have a frontal bone, you have frontal lobes in your brain. Oculus for eye, which sometimes you'll hear that called the orbit or orbital or ocular. Auris, A-U-R-I-S for ear. Only veterinarians use that that I know of. In medical school, nursing school, they're going to teach you otic, O-T-I-C. Bucca or bucca, I've heard it pronounced both ways. Namely, you'll hear it used like the buccal mucosa, you know. Nasus, we talked about for nose, nasal. Cervices, you don't hear it used like that. You'll say, "Oh, they hurt their neck and they have on a cervical collar." Let's go over here on the shoulder. That's acromial, the acromial region. And back over here, mentis, the chin. Um, you'll hear it used like mental. There's a little foramen right there in the bone called the mental foramen. There's muscle named after that, mentalis. Axilla, I think of Axe deodorant. I don't know if that's where I got the name, but axillary is the region. Going down here, the brachium. So you have a brachial, artery or vein. There's a muscle called the brachialis. So a lot of things are named after these locations. So don't just think, oh, I'm never going to hear this again. You use it over and over and over. Things are named after them, bones, muscles, whatever. Antebrachium, ante just means before, like an antebellum home. That means a home built before the war. Um, Carpus or carpal, like I'm sure you've heard of carpal tunnel syndrome. That's the wrist, right? Palma for the palm. Um, Pollex for the thumb. It's got its own little name. Don't confuse it with hallux for the big toe, right? Digits. Also, you got digits down here. Technically, they're all digits. Um, then let's go here. I forgot this one in our Zoom lecture. Inguinal. Uh, you never hear it used like that. Inguin. It's inguinal. Like you can have an inguinal hernia in this region right here. Pelvic or pelvis. Umbilicus or that's where the umbilical cord is when you're born. Um, Abdomen or abdominal, the abdominal region, right? Mamma or mammary glands, you've heard of that. Thoracis, the chest is the thoracic region. The femur or femoral region, and there's a bone named the femur, obviously. Patella, which is the kneecap. Um, patellar is the region. Crus, weird one. Crural, you hardly ever hear either one of these used. They just go, oh, the shin. Yeah, I know that's layman's term, but that's pretty much what everybody says. Same thing back here for the calf. Hardly anyone ever calls it sura or the sural region. They'll say calf. I know it's just common term, but that's what everybody uses. But it's fair game. Crus and sura are fair game. So I remember crus because it starts with a hard C, and that's the part that hits the coffee table when you're not looking and you're walking in the dark in your living room. And coffee table starts with a hard C. So that's the way I remember crus. It's stupid, but it works for me. Digits we did. Plantar surface of the foot. Don't forget hallux for the big toe. Pes or ped for the foot. Pedal means foot or base. Manus for hand, like you have manual dexterity. Calcaneus, that's the heel. There's a calcaneus um, bone. There's a calcaneal tendon, which is otherwise known as the Achilles tendon, the old name. Popliteus, that's behind the knee. Popliteal. Is there a muscle called the popliteus? Yeah. Is there a artery runs back there called the popliteal artery? Yep. Gluteus or um, gluteal, you know. So you have a gluteus maximus, gluteus medius, gluteus minimus. Those are muscles. Um, buttocks, that's the region also. Lumbar or lumbus, like you go, oh, I have a lumbar support in my automobile in the seat. Olecranon, uh, that's a protrusion on the bone right there on the ulna. It's called the olecranon process. What else? We did cervices, we did cephalic, upper limb, lower limb. Uh, did those. Anyway, so that should give you a, I could ask 5 or 6 of these on on the big test, not on a quiz. Quizzes are multiple choice, but I could point. I have this guy with no words, and I can point there and name that region. You go pollex. Name that region, antebrachial region. What is that region or structure? Umbilicus, right? Chin would be and you go the mental region or the mentis. Okay, so yeah, some of these can show up. So make sure you know. Same thing. We did these. We did all the proximal and distal on a limb, right? We did anterior, posterior versus ventral and dorsal. We did cranial and caudal. Veterinarians use cranial and caudal more than MDs. Just remember on a limb, you have to use proximal and distal. You can't use superior and inferior. We did the planes. Don't forget the oblique. The oblique can be any angle. Now, let's go over the cavities. So this whole region right here is a dorsal cavity. That's the dorsal cavity, and it's divided into two, the cranial and the spinal cavities. The cranial cavity and the spinal cavity. I go, what two cavities make up the dorsal body cavity? Boom, boom, you got it. Here's a thoracic cavity, and you got 1, 2, 3 cavities in there and a space. Don't forget the space. So let's do the cavities first. You have a right and a left pleural cavity. You have a pericardial cavity. Peri means around in this case. And then the space right here, the surrounding and even including this pericardial cavity, that's the mediastinum or mediastinum. Okay, I've heard it pronounced both ways. Abdominal pelvic cavity. So you have an abdominal cavity here, pelvic cavity here. Now there's not a good membrane that goes across here and completely divides these in two. So you got to use your imagination there. But yeah, they're calling it two different cavities. So if I say, what's the light blue? You would go abdominal cavity. What's the dark blue? You go pelvic cavity. What's the cavity within these two cavities? It's kind of like a cavity. I wish this could draw, but say, follow my little cursor here. If you went inside of here like that, that would be the peritoneal cavity, right? And so, let's see if they have it on here, dorsal. Peritoneal, Peritoneal. So it's cavity within that cavity, okay? Now, can things be retroperitoneal, meaning behind the peritoneal cavity? Yeah, so back here you can have kidneys and your ureters, so there are certain things that are retroperitoneal. And we'll get more into that when we get to other organ systems later on, other tests. Okay? Now, the membranes that line these things, so the ones lining the pleural cavities would be the pleural membranes. The ones lining around your heart would be this was around the lungs. I don't know. Hopefully I said that. So around the lungs would be the pleural. Around the heart would be the pericardial. And then the peritoneal membranes would be down in that abdominal pelvic region. And so let me show you how to name these. All right, let's look at the heart. So think of it as a balloon that's just got a little bit of air in it, and then the heart is punched into it like you punch your fist into a balloon that's not fully inflated. So the balloon that would be touching your hand all over, all of this area, all of that, would be the visceral layer of that membrane. Where the outer layer of that balloon, say you got a little air in between here if it was a balloon, that out here would be the parietal. So visceral versus parietal. So you'd have a visceral pericardial membrane and a parietal pericardial membrane. Now, those are just directional terms. Visceral is on the organ itself. Parietal is away from it. So you could take scissors and cut through this parietal. It's like the heart's in a little sac almost. And then once you cut through that, then you see all this shiny stuff on the heart itself, and that would be the visceral pericardial membrane. All right, on the lung, it's the same deal. So on the lung itself would be visceral plural. Against the body wall or the ribs out here would be the parietal plural. So you see what's going on. You just name visceral or parietal first, and then you name the cavity you're in second. The problem is there's a lot of stuff starts with a P. So if most of your small intestines down here, the shiny stuff on them, well, that would be visceral, right? But you name it after that very specific cavity, peritoneal, visceral peritoneal membrane. Where against the body wall would be the parietal peritoneal membrane. So you'll just have to look at it and go over it a few times. Just remember you name visceral or parietal first, and then you name the cavity you're in second. So if I put a piece of tape on a torso model or whatever and say, what is this organ? You go, lung. What's this shiny membrane that's on that lung itself? And you would go, don't just go plural membrane. That's only half a point. Go visceral plural membrane. What's that shiny membrane that's against the ribs, away from the lung? And you go, oh, that's my parietal plural membrane. Okay? So it'll take a little practice till you get it. All right? So levels of organization, you got the chemical, then the cellular, then the tissue, then the organ level, then the organ system level, and then the organism. So don't stress on it. You're just going from the smallest to the largest. If I did this on a quiz, maybe, I might could put, do this 5 times, and I would flip these things around and have you pick out the right order. What if I put tissue in front of cellular? That one's wrong, right? So just make sure you go from the smallest to the largest, and then that's the correct order. Okay. Like an organ is made up of tissue. So think of the stomach. You got maybe 4 different tissue types in there. Big tissue types. You got epithelium on the inside. You got connective tissue connecting it all together. You have neural tissue. There's nerves going there. And you have muscle, right? Smooth muscle around it. So all 4 of those tissue types happen to be making up that stomach. Okay. All right. So skin. So the integumentary system, skin, hair, and nails, right? So the the skin is basically one of your largest organs when you think about it. Okay. Skeletal system, we're just going to ask you common, fairly large bones on the intro. We're not getting picky. We're not asking landmarks. But if I point it, that, make sure you know that's a humerus. Make sure you know radius versus ulna, right? Make sure you know femur, tibia and fibula, maybe vertebra. You don't have to know the separate kinds, but make sure you know axial division versus appendicular. So if I point at the humerus, you go, what division of the skeletal system is that in? You go, appendicular. What about the skull and the backbone or the vertebra? What division are we in? You would go the axial division. It's like an axis running up and down. Everything in gold is axial, right? everything that's kind of brown is appendicular. The only way I could try to fool you is maybe put it on the scapula or the clavicle or this, this ilium or something like that, and go, what is that? And that's just appendicular. Okay. The sacrum and the little coccyx down there, that's all axial. Okay. I'd probably just do something easy though. Same thing on muscles, axial versus appendicular. We don't need to know separate muscles yet. Like if I pointed at this rectus abdominis here, is that axial or appendicular? Those are axial. If I pointed out here, brachioradialis, we don't need to know these yet. You go, oh, appendicular. Okay. Endocrine, don't worry about pineal or pituitary gland on this test. Yeah, those are kind of tiny up in here. We'll get to those. But make sure you know thyroid. Don't confuse it with thymus. Thymus is mainly in the lymphatic system, but it does make a hormone, so it's double duty and it's part of the endocrine. So don't confuse thymus with thyroid. Totally different organs. By the way, thymus is not normally this big in an adult. They kind of go away. They kind of atrophy in an adult. In a kid, yeah, they're fairly large. Pancreas, another double duty. There's an endocrine part. The little, we don't need to know them yet, but the little aisles of Langerhans, they make insulin and glucagon. Insulin lowers your blood sugar. A glucagon raises it. So that's the endocrine part. But the rest of the pancreas is in the digestive system, so it's making digestive enzymes. Don't forget adrenal glands, right? They make adrenaline. We'll get to that on another test. They make other, hormones in addition to that adrenaline. You got ovaries and testes, so they're showing two different views. This is male, this is female. Testes down here, so there's a testicle. So that's in the reproductive system, but it's also in the endocrine system because of testosterone. And then you got ovaries, which are in the reproductive system, but they're also in the endocrine system. They make hormones too, right? Estrogen, progesterone. Okay, just don't confuse the thymus with the thyroid. Flip that thyroid around. On the back of it, on the sides, there are parathyroids. There's 4 of them. Don't worry about pineal and pituitary other than true or false. True or false. True or false. Is the pineal gland part of your endocrine system? That's about all I could ask. On the heart, make sure you know right and left atria and right and left ventricles, just the chambers. I have put that on test 1. Like there's the right atrium, right ventricle, left atrium, left ventricle. If you look over here, that muscle on the outside of the left ventricle is a lot thicker than it is on the right side. That's the way you can tell the right from the left. Because this has to pump to the whole body, so it's got to, produce a lot of pressure. So that muscle is bigger, it's more hypertrophied. So don't forget the little membrane on the outside here, that would be visceral, on the heart itself, visceral pericardial membrane. Okay, and you're not seeing the parietal pericardial, that would be gone, so you can see the heart. And just no arteries and veins. I'm not going to get that picky, just not counting on the heart itself. Arteries carry blood away from the heart, and then veins carry blood to the heart. That's about it. And usually they have arteries in red and veins in blue, but you can't always go by that. And when we get to cardiovascular, I'll explain why. Another test. Lymphatic. Make sure you know the tonsils. You don't need to know the separate ones like the pharyngeal and the lingual and the palatine. Just know they're tonsils, right? Thymus, I mainly think of that as lymphatic. Don't forget your lymph nodes are in a lot of places. Don't forget your lymphatic vessels, a lot of places. Don't forget your spleen, right? It's like a gigantic lymph node almost, except for it's fed by blood and it's on the left side. Can you live without your spleen? Yeah, it's better to have it. All right, there's a better representation of the spleen. There's the thymus also. Once again, they drew it too big. In an adult, it's not going to be that large. Respiratory, just know the major big parts right here, like right and left lung, right and left primary bronchus, and the trachea. We're not going to get any pickier than that. Don't forget the membranes. If I said, what membrane is shiny on the lung itself, you go visceral. Visceral, plural. Okay. Yeah, so this is too many parts for your intro test. Don't worry, we'll get to it on another test. Same thing with digestive. Got way too many parts here. Let's just do the biggies. So yeah, so don't forget salivary glands. I can point. You don't need to know separate ones. I just point and go, what is that salivary gland? You don't need to know parotid, mandibular, sublingual. We'll get to that later. Esophagus goes down into the stomach. These are fair game. Goes into the small intestines, and they're not showing all of those. They've taken them away. You don't need to know the different parts of the small intestines. We'll get to those later. Same thing with the large intestine or the colon. You don't need to know ascending, transverse, descending, blah, blah, blah. Oh, there's your small intestines. They just pulled them to the side. Yeah, so you don't need to know duodenum, jejunum, ileum. You don't need to know ascending colon, transverse colon, descending sigmoid, none of that. If I just point anywhere on the colon, you go colon. If you point anywhere on the small intestines, you go small intestines. We'll get to the other parts, another test. Gallbladder, yeah, fair game. It stores bile. It's very important. True or false? Does the gallbladder make bile? No. It stores it. The liver makes bile. It does a lot of other things too, maybe 400 other things, but it makes the bile. The gallbladder stores the bile, which helps emulsify fat. And we'll get to that on another test. So emulsify fat just means it divides it up into, it makes it into smaller and smaller globules. It doesn't chemically break it down. It just makes it smaller so that your enzymes can work better to break down the fat. Okay, I think we're cool there. Same thing here. All I'm giving you on urinary is just kidneys, ureters. I'm pronouncing it wrong, so you'll spell it right. It's pronounced ureter. And then bladder, and then urethra. Okay, don't worry about prostate. None of that. I'm not going to ask you that. Just the four main parts: kidney, ureter, bladder, urethra. Whatever you do, don't spell the urethra wrong and don't spell the ureter wrong, because you're going to be writing these things in charts. And if you had a kidney stone stuck in the ureter, it's totally different than a kidney stone stuck in the urethra. So you gotta be able to get this across to your colleagues that you're talking to, because it's very important. So anyway, so you got to spell it 100% right, or you're going to get counted off the whole thing, because I don't like seeing these two things misspelled, right? Okay, so if you won't even get half off, you'll get the whole thing off if you spell it wrong. So make sure you spell ureter correctly, and make sure you spell urethra correctly. Okay. On the female, I'm just giving you four main parts for now. So we'll go vagina, uterus, fallopian tube. You can say uterine tube. I don't like that. We have enough stuff that starts with a U. So I use the old name, even though it's a little harder to spell, fallopian tube. And then ovary. So ovary, fallopian tube, uterus. Make sure you spell uterus correctly, right? And then vagina. And so this is a kind of a frontal view. If you look at a sagittal view, make sure you can find vagina, uterus, ovary, and fallopian tube. Don't confuse the uterus with the bladder. Don't confuse the vagina with the urethra. Very important. Okay. And on the male, they give you too many parts here. I'm just giving you, I guess, 5. So let's go testes. Let's go epididymis, which is a little collection area, a little holding pen, basically, on top of the testis for the sperm. And then let's go vas deferens. It's also called ductus deferens, but everybody calls it vas deferens. You probably heard of a vasectomy before. And then let's go penis, and then let's put urethra in there also, because that's in the reproductive system on the male. Don't forget. So on a sagittal view, you'd have testes. You would have epididymis. Make sure you spell it right. You'd have the vas deferens. Right? There's the prostate. The prostate goes all the way around this urethra. Right? That's why if that prostate swells up, it can cut off the flow of urine, cause a big problem. And then the urethra and the penis. So it's 5 things on the map for the intro test. So this is kind of the way that it could be done. I could label A, B, C, D. Well, like A, what's that region? You would go femoral. What is B? You go pollex. What is C? You go brachial region. What's right on the front? Frontal region. Right? Same thing with organelles. Make sure you know the little, maybe a 1-sentence definition of what these things do. Make sure you know cilia, microvilli, lysosomes, mitochondria, centriole, Golgi, smooth and rough ER, nucleus, and plasma membrane. All right, I think we're good. All right, so that's not quite 30 minutes, but that's close enough. And then I'll also post this to YouTube. All right.